Hey everybody, Vic Lombardi here for the first ever podcast / webcast on prostate cancer awareness. My goal here is to interview everybody that's involved in this process: doctors, nurses, advocates, and fellow patients, survivors, battlers, like Jeremy Siefkas, my buddy. That's how you pronounce your last name, right?
Siefkas, yeah.
Right there. How do you spell it?
Siefkas.
Siefkas. What is that?
Dutch-German.
Dutch-German descent.
Yeah.
So the way it goes with me, Jeremy, and before we get going here, I thought like any good podcast, maybe I'd play some notes, just strum a little guitar to get us going. Problem is I have no idea how to play the guitar. Jeremy, do you?
Oh, wow. We can try.
All right, what do you play? How long have you been playing?
A few years.
Okay, what do you got?
This is a little wagon wheel.
Wow, you know how to use that instrument. I wish I was musically inclined. How many podcasts do you get with music in the background like this? Self-made. How beautiful is this? All right, that's enough. Thanks, Jeremy. Appreciate it. All right, let's get down to business. Now, the intent here is to have a free-flowing conversation like we did that night we went out.
Yeah.
The wives, we had dinner, just to talk about what we've gone through, what we're facing coming up, our fears, our hopes, our dreams, all that stuff. So, and the intent also is to educate those who are about to undergo that same journey. Because I know I was in those shoes 8 weeks ago, and you were too.
Yeah.
Where you had no idea what you're up against.
Didn't know
you
what to
had
expect.
no clue what this meant, what the surgery was going to feel like, and it's scary. Excuse my language, but this is on the internet. I was scared shitless. You?
Scared shitless.
And
no doubt about it.
If not for relationships like this and the internet and people getting word, let's go back to how we met. So I was diagnosed on February 1st. I'll never forget it. It was 3:45 in the afternoon. I got a call from my doctor, got some news to report, and I didn't hear anything after he said cancer. Every other word he said after cancer, it's lost on me right now. I just knew I had cancer. When were you diagnosed?
January 10th, 2 o'clock. Yeah. Didn't hear a word after we got to talk. You have cancer.
And that feeling, that it's almost surreal. I almost did not want to believe it. For me, I'm defiant when it comes to that stuff, Jeremy. I was like, no, there's no way. I'm going to go get retested, and it's going to be some sort of infection. I'm fine. I feel fine.
Yeah. Check your charts.
Exactly.
That's not me.
Yeah.
Wrong, Jeremy.
Well, and the reason why, I think, and the reason we're doing this is because there's so many 40-somethings who are getting diagnosed with prostate cancer, and it hits them like a truck because feel healthy, no symptoms, no family history from my family. All of a sudden, I go to the doctor on a random physical in December, and one thing leads to another, and I have cancer. You felt fine, didn't you?
I had no symptoms, and when I went in for a physical, much like you did, right? And I was gonna blow it off, and thank God I didn't.
Okay, why did you go get a physical?
My wife and son. Hey, you haven't got a physical in a couple years.
How long had it been?
Probably 2 years.
Okay, so
2 years.
For you, like me, I went randomly too, as fate would have it. The fate's it's crazy. Just a random shot at it.
Yeah.
It's interesting because when my doctor brought up prostate and you need to go get a prostate exam, you hear those words. I have no idea what they mean. I didn't know in December what a prostate was.
I did. My father had prostate cancer.
So you have some history.
I had some history, right? So I knew, and I thought the worst when he said, "Oh, you have a high PSA," right?
So you knew already all that terminology.
Yeah, I knew some of the terminology, and I knew I knew of it. Didn't know what to expect, nothing like that. So it was still, nonetheless, shocking.
Okay, I'm 49 years old. Jeremy?
46.
You're 46. We're supposed to be deemed too young for this crap, okay? Especially a guy who has no family history. You have family history, so you would think maybe you're in that high-risk category.
It's on the radar, right? But not me personally.
Sure. And that's why a lot of doctors, they don't even think about checking you until you're 50. It's just not in the conversation. Nobody even thinks about it. We were both fortunate to go down the road where we got checked, where the PSA was taken.
It's not in their book of business to do that at a physical.
I wonder why. It just, if you
Good
look
question.
healthy, feel healthy, and that's for another day. I mean, we're going to talk to some doctors and researchers and go down that road. That's for another day. The bottom line is we're both fortunate because we caught it at an opportune time. Now, you can go into a debate about what it's like after the fact. So you got diagnosed in January. I got diagnosed in February. My immediate move was, okay, what the hell do I do now? And I spent 2 days in a rabbit hole on the internet that were the darkest 2 days of my life. I went to places on the internet, checking lifespan, checking cancer across all boards. How long will I be around? Do I have a will? Am I going to die next week? Is it in my brain? Is it in my feet? I mean, where is it?
Yeah.
I had everything going through my mind. You?
Absolutely. It's like, oh gosh, my hip hurts. Is
Yes.
it in my hip now? I mean, yeah, you go to places where you never thought you'd be.
I felt sorry for myself for a while.
Yeah, that's a good way to put it.
Yeah.
Yeah.
But it's funny. Now that you look at it, the whole sympathy thing, I was more, in the grand scheme of things, upset at the fact that this nuisance is impacting my life. It was more like, why do I have to deal with this crap? I got a busy life to lead. I don't have time for
Things
this
to
right
do.
now.
Yeah. Busy.
Very busy, and now I got to deal with cancer. So your next move was what after diagnosis?
So schedule then, this follow-up exam or follow-up consultation with doctor.
Okay.
Had that information at hand, and I just didn't like what I heard, right? From
Why?
that first
Why
doctor.
didn't you like it?
I just it didn't, I don't know, it didn't feel right with that doctor. I didn't click.
Sure.
Just didn't feel right. And
Okay.
his explanation of next steps and matter of fact, this isn't matter of fact to me. This could take my life.
Sure.
So it's not matter of fact in this case. So I got a second opinion and hit it off with this doctor. Felt good.
Why? What resonated?
This is explanation, his protocol, his care after care. How long you have to have a catheter and things like that.
It's more descriptive for you.
Descriptive. It made sense to me. It made sense, and it wasn't matter of fact. Like, this guy has my life in his hands potentially, and I think I'm in good hands.
Okay, so you decided to go to a different doctor, and then you scheduled surgery. Did you ever consider anything but surgery?
I was never given any options but surgery.
Yeah, me too. And the reason why, Jeremy, ironically, he and I coincidentally are both Gleason 9 cancer patients.
Yep.
Prostate cancer.
Prostate brothers.
Yeah, you learn early on. I'll never forget when I left my doctor's office, and we had the discussion as well. A friend of mine called up and said, "What's your Gleason score?" I go, "I don't want to be talking about my GPA right now from college." What do you mean? What the hell's a Gleason score? You learn quickly.
Yeah.
You learn quickly what that is. So for those of you, you're not going to watch this if you're not a would-be patient or somebody in the administration process here, but a Gleason score clearly impacts what you do next. And if you're there's much difference between a Gleason 6 and 7 and a Gleason 9.
Absolutely.
We know the difference.
Know the difference.
They tell you the difference.
Have a friend that was just diagnosed 2 weeks ago, and a Gleason 3-4, right? So 7.
Sure.
And now it's a wishful or a wakeful watch, whatever
Exactly, yeah,
that terminology is
mhm.
right now. So they're just going to keep an eye on it, and that wasn't the hand we were dealt.
Not at all. And in some ways, it's not. Listen, I didn't mind that. Even if a doc told me I was a Gleason 7, I'm the kind of guy where I don't care. I want it out.
Right.
I probably would have done the same exact thing.
Yeah.
I was in a hurry to get mine out of my body. I don't know if you were.
Yeah, you're cancer. Like, get rid of it.
Yes.
As fast as we can.
As much as you can.
Can I take a pill? What's next?
Yeah, and then you're asked about, you want to do clinical trials. Do you want to do this? You hear about the hormone therapy, the radiation. There are so many things that are swimming through your head.
Yeah.
And as you prepare for the surgery, and we went to dinner. Did we go to dinner after surgery? Yes.
Yeah,
Yes, it was post-surgery.
yeah.
The wives.
About 3 weeks.
Exactly.
Yeah, 3 weeks, yeah.
So the surgical process for me, as you're walking up to that date, all the questions I'm trying to answer, all the research I'm trying to do, I feel like a doctor. I don't know about you. I've got so much information swimming through my head.
I can talk shop now.
Exactly right.
Best
Talking
of-
shop
yeah.
with the best.
Yeah.
So all that does in many respects is cause some anxiety for the surgery. But the truth of the matter is we both had the same type of surgery, robotic surgery, right? The surgery, the process of surgery itself was the easiest thing in this whole process. It was easy for me and you.
Oh, if you said surgery, like, oh gosh, what's this going to entail? I'm going to be laid up. What's rehab? Like surgery, I can't even tell I had surgery right now. Nor you, right? I mean, it's
My scars are healing.
Yeah.
I know you're ahead of schedule because you
Yeah.
were a week before me. I saw your scars soon after surgery. You looked like you were already healed.
Yeah.
But, and it's funny when you tell people that because, they cut into you, right? They go deep. They take out a gland that's deep in your bowels, essentially. They pull it right out of there. And you're thinking this is going to be, and you read on, it's going to be a month to 2 month. Dude, I felt fine after 2 weeks.
You were running after 2 weeks.
I pretty much, you?
Yeah, I felt great.
And that doesn't
hard-pressed,
apply to everybody,
No,
okay?
no.
A lot of it, there's a lot of things that go into play. What kind of shape you're in, the surgery itself, how much they had to remove 31 of my lymph nodes.
I had no lymph nodes removed, so I had a little bit different recovery than you, right?
Yeah,
So
you had less bruising.
had less
You remember the
bruising.
bruising I
Oh,
had.
gosh, yeah.
So when you were in your surgery, did they tell you that they might possibly have to take lymph nodes, or was that something that they noticed when they went in?
It was so you signed that surgery
Sure.
disclosure,
Yeah.
and it was if we see lymph nodes, we're going to take them. But they liked what they saw, and they didn't have to.
Great.
So,
Yeah, they decided to take mine because we're a little slightly different. As much as we're the same, the one difference between our two prostate cancers is my prostate cancer crept outside of the prostate itself. I can't tell you what the term is called because I can't pronounce it, but it crept right outside the prostate. Now, my margins came back negative, which means they got it all. My lymph nodes came back negative, which means it did not go there, but it got outside the prostate. So I am deemed a stage 3 prostate cancer survivor. You're stage 2. Why?
Right, because mine did not breach the prostate, so
There you go.
it was contained in the capsule, and they got it all just like yours, but it hadn't had a chance to creep outside, for lack of a better term, because I can't pronounce that word either.
Okay, we're going to do this chronologically, so we'll get to all the details. So you're sitting in that surgery room. You go through the surgery process itself. You're put under. By the way, the best sleep I've had in years. It was wonderful for me.
Yeah, there's 2 hours. 3 hours. I don't
You
know what
wake
it was.
up-
I don't. Yeah,
Yeah,
it was
you
good
wake up
sleep.
and you're like, I feel a little off, but it wasn't the worst thing.
No.
You go home the next day, as you well did. You're wearing a catheter, which wasn't fun. Now, you went 2 weeks with the catheter.
I went 16 days.
16 days.
Yeah.
Wow. Bonus time.
Sweet 16.
I went just a week. And everybody had these war stories about the catheter. I didn't mind carrying a bag of urine around with me. It was almost convenient.
It was convenient. It was great. You go have a beer, and you're not gonna get up.
Honest to God, I didn't worry about it. The stuff that people worry about is the least of your concerns.
least of your
It really is. The only thing I still worry about, and I worried about during the process, is the anxiety of getting the cancer. I didn't care about all the ancillary items that went with it. Get the cancer out.
Get
it out.
I'll deal with everything but the cancer.
Yes.
Get the cancer out.
Yes. And if you're hung up for a month, whatever, it doesn't matter. We're both active. You ride bikes. I ride bikes. We're both cyclists. You're much more so than I am. I guess the biggest downside here is that you can't ride for a while, right? What'd your doctor tell you?
So I went and saw my doctor Monday, had my PSA blood test, first one, and he said at least 8 weeks. So that
Did you ask why? Why 8 weeks?
It's the pressure sitting on the seat because the prostate buffered that pressure.
Okay.
And the way that they join the urethra back to the bladder, you just don't want that scarring. You don't want any of that pressure on that right now.
All right. I get that. So the first couple of weeks when you're at home and you're convalescing and you can still feel something's wrong with your stomach, you're sensitive to it, you're eating nothing but soup, right? You remember those couple
Soup.
weeks. And then when you get to, there's a certain point you hit, and everyone's different, where incontinence aside here, sexual dysfunction aside, I'm just talking about how you feel. You get to that point like, God, I want to go back to doing what I was doing. And they don't want you to.
No.
Like they yelled at me when they found out that I went jogging 2 weeks after surgery. I got yelled at.
Don't do it.
Yeah, so because there are things that still are shaky inside. But like right now, 2 weeks, I physically felt great. And I know you do too.
Absolutely. Hard pressed to say that I had a surgery 6 weeks ago.
Okay, let's get that out of the way. Now comes the hard part, and the stuff where, and one of the reasons I want to do this podcast is men are so secretive and so sheltered and so afraid to talk about things that women are so open about, right? What happens to a man when your prostate is removed? I get that question asked all the time. Well, first thing is you're not having babies anymore, because the prostate gland is the gland in the human body, the male body, that produces the semen, correct?
Correct.
So that's gone. So you have a child?
I do.
Beautiful.
14-year-old son.
All right, I've got 3 kids. I'm not in the baby making business anymore, either are you.
Nope.
All right, so for those
Well, maybe
of you,
the trying business.
yeah, the trying, but the making, the
making.
producing,
Yeah.
unless you froze some sperm
Yeah,
beforehand,
you're not
that's
having
gone.
babies yet.
So for those of you, I feel your pain. For those of you who are in your 40s or in your 50s, who still look to produce and all that, that's the toughest part. It's got to be the toughest
gotta be
part
the
of
toughest
this.
part,
There's no doubt. That didn't impact me because I was snipped anyway. I had a vasectomy.
Me too. Year after my son was born.
Did you?
So, yeah.
I had
Wasn't
mine.
having babies.
I think I had mine a day after my 3rd.
Yeah.
So anyway, that was not in the question anymore. So the sexual function it takes time, and everyone's different. It's funny. As soon as I left the doctor, you go to the pharmacy and they say, "Okay, you got to pick up this pill, and that pill." I stayed away from the painkillers. I didn't take many of them, but they also assign you Viagra. essentially.
Viagra, Cialis, yeah.
Yeah, all that stuff.
Yeah.
And I'm looking at this going, so all my life, this is sort of like a funny look. Yeah, look at these guys. Old dudes take Viagra, right? Like, what do I need? And now I'm eating these things like they're M&Ms.
Yeah.
And I didn't understand why, but you need to stimulate the nerves again. You need to get the nerves working. Because the one thing he and I have in common, too, is part of our surgical process, they had to take one set of my nerves.
Right. They took, I think I remember your right nerve, right?
I forget which one. They took one set of my nerves. They took one set of your nerves.
Both sides of the prostate have a nerve. Unfortunately, they weren't able to salvage both.
Now, why? I'm curious. If your prostate was intact and nothing burst, why did they have to take your nerves still?
Because the highest cancer was on my left side of the prostate.
But if it never got outside the prostate, what does it matter?
He didn't want to take the chance of possibly having a margin come back that wasn't clean.
Smart. I'd rather have it that way
okay.
too.
Right.
Yeah, I'd rather have it that way too. So when you're taking the nerves one side or the other, you're going to have some issues.
Sure.
That comes with the territory.
Sure.
I think both of us can agree. And when you're looking at these issues in retrospect, you're like, oh my God, I'm going to have to deal with that. Oh my God, how am I going to do? Oh my God. And then as it approaches and you're dealing with these things, it's like, why was I so concerned about this?
Yeah.
Don't you feel the same way?
You worry a lot for nothing.
You worry about things that, change is hard for anybody. But you just, we're both outdoors guys.
Yeah.
You're going up a hill with a bike. You have that anxiety when you see a big hill that you have to climb. But as you're into it, you're like, I've done this before.
Yep.
You adapt.
You adapt. You adapt. That's a good way to describe it.
So the sexual function, listen, everyone adapts differently. What Jeremy does, I may do differently. But I don't think it's as worrisome as some make it out to be. The other thing for me, and I brought in a little show and tell. I never knew at the age of 49 I would be in the business of the adult diaper. But here it is, and it's beautiful. It's beautiful. I bought mediums, schmediums if you want to consider, and I got these in bulk. I got 2 boxes of these. Well, here we are, 5 weeks after my surgery, and I still have 2 boxes.
You still have
of
2
these.
boxes. Yeah.
I think I used 2 or 3 diapers.
Yeah. I have a few left too, so we can donate to whoever needs them.
I mean, it's amazing. So you go diaper shopping. Once you remove the catheter, you have a couple days there where you're like, whoa, whoa, whoa. I'm just peeing everywhere, right?
Yeah.
Did you have that?
Yeah, there's no control there.
Exactly.
For sure.
You're just peeing everywhere.
No control.
Were you the one who told me the story? No, I had another friend who told me the story about the pee issue. But anyway, so the diapers are essential, or at least pads. My first week at home post-surgery, I pretty much wet myself every night in bed. I didn't do it too much during the day. I can control it during the day. You do the Kegels, you're aware. But at night, when my body relaxed, I was in trouble. You?
Yeah. Not so much here and there, but mine was a little bit different experience. I didn't have a lot of leakage. Yes, leakage, but never. I think what we talked about at night.
So never at night. You never woke up with a diaper full of pee.
Never did, and knock on wood.
Good for you, because I woke up twice. I was peeing everywhere. I was like, and that to me in this whole process. Again, the surgery was a breeze. The most humbling element for me was waking up at 3 a.m. one night and I got pee all over the bed. And I was sleeping in my daughter's bed because, just my convalescence room. And I'm sitting there thinking to myself, I just peed my daughter's bed. I'm 49 years old, and I got pee coming out, and I can't control it. And that's one of the few times I felt sorry for myself. I was like, and I don't know what to do about it.
You can. What do you do?
Yeah.
There's nothing you can do.
But, again, the next night, you're like, okay, I'm going to try and do something different. I won't drink as much before. The next night, you do something different. You learn to adapt. You learn these are not evil. They're not the enemy. They actually fit pretty good, and they don't feel that bad.
They're your friend.
They are really not that bad. So you go shopping for these. You make amends. As we speak, I'm 5 weeks removed. You're 6 weeks removed. Mm-hmm. Are you wearing anything?
Nope.
You're
just
pad
underwear.
Free.
Pad free.
Okay, I'm wearing a light pad. Yep. I'm wearing a light pad because I still, if I'm going to work tonight, I'm going to be in the public. I don't want to show up in the public and have an accident.
Well, I texted you last night on one of those goals with the ass. I stood up too fast, and I'm like, this might not be
It's so
good.
funny that you say that. A few days ago, I'm doing an on-ice interview. So I'm a sportscaster in my real job. I'm doing an on-ice live interview with a member of the Avalanche. And I'm on the ice, and I got my dress shoes on. So I'm afraid I'm going to fall. And so as I'm interviewing him and I turn, I slip a little bit. And so to catch myself, one of the muscles, and you're sitting there going, thank God I'm wearing a pad.
It's safe.
I mean, these are things I thought I'd have to worry about when I was 90, not 49.
Yeah.
But you know what? You smile, you move through it. If that's the worst case scenario, it is what it is.
It is what it is.
It doesn't bother me like I thought it would. And if there's a key to this podcast, understand, guys, what was really going to bother you and what's not. The anxiety should be held for certain things. It shouldn't be held on crap like this, peeing. The sexual function will come back. What are other people going to think? All that stuff means nothing. It means absolutely nothing. Here's another item. Your diet. Has it changed? Have you changed it? Have you tried to change it?
I've tried to change it, yes.
Okay.
And you and I have had some in-depth
We've had this conversation.
Yeah. I've tried to change it. Working on that. You're way further down the line than I am with your diet.
I think I'm just more scared than you are. My diet, I don't know, what was your diet before?
My wife tries to get me to eat healthy, right? Yeah. But I'm, I like a Coke here and there and popcorn and chips and, all that good stuff that's not good for you, right? But we do eat healthy. I'm still down that line of red meat and things like that where I know that you've made some changes. But I do think it's important. It's on my radar to do. Haven't fully implemented it yet.
See, before diagnosis, I was on the I'll eat whatever the hell I want when I want diet.
Yeah.
I was 178 pounds before diagnosis. I was 178 pounds. I haven't moved beyond 2 or 3 pounds since college. So I had high metabolism. I worked out. I felt that because I work out, I can eat whatever I want. And I did, openly. And I'm not saying it's good or bad. I'm just saying I've done enough reading, I guess, and I want my immune system working properly. I've made some not so subtle changes. I grew up in the Italian environment, eating spaghetti and mozzarella and all that stuff, and sauce and sausage and meatballs, and eating as much as I wanted. I'm a sugar fanatic. I mean, I'd wake up every morning, have my 4 cups of coffee, and each one of them had half sugar.
Half sugar,
just
right.
a sugar fanatic.
Yeah.
Brownies. My morning breakfast was something sweet.
Oh, for sure.
That's just the way it operated. So that changed. I'm not into sweets anymore like I was. I'm into more veggies. I'm into more fish. I'm into more of that stuff. Will I last? I don't know. I can't promise you because, boy, am I sick of eating fish, Jeremy.
I think you have to be realistic, right? I mean, set some realistic goals. And I know that I couldn't jump in what you did. I would set myself up for failure on that. So
yeah, I'm not saying that I'm going to finish that road. It's just it's very hard to do. And I know some guys and gals, they get that cancer revelation and they go cold turkey.
Yeah,
and I get it, and I understand why. I'm having some difficulties watching my friends and brothers and families eat, and I got to sit there and I'm on the outside looking in, going, "Oh, let me have that cauliflower again." That's the toughest part for me.
That's the toughest part, yeah.
Yeah, so it gets old. So your diet, a little better, but not all the way.
A little better, not all the way.
Okay. So what happens when you get diagnosed, you go through the surgery. Every day that goes by, you're starting to feel better. But cancer's weird because people say, well, good job. You had the surgery. I don't know if you got this. Hey, congratulations. You look good. You had the surgery. You got this thing beaten. And here's my philosophy. Cancer's never beaten. You're never cured of cancer, in my eyes. You've got it under control. You've got it managed. You always have to be vigilant. How many stories have you heard of guys who, it's over. They got it beaten. They got surgery. And then 3 years later, there's a recurrence.
Yeah.
Especially with our Gleason scores.
With our Gleason scores, for sure.
The higher the Gleason score, the higher you're likely to have a recurrence, no matter what. So you have to be wary. And that's the truth. You may not like to hear the truth. I don't mind talking about it.
You can't ignore the truth. So why ignore it?
My doctor's been very point blank with me about that. I mean, don't worry so much about your scores now. Worry about maintaining your scores.
Right.
And not having that thing skyrocket. So when you have the prostate removed, the next big day, besides getting the catheter out, is your first PSA test. Because your first PSA test, by and large, you don't have a prostate anymore. It should come back at 0 since you have no prostate or somewhere near there.
Somewhere near there.
Okay?
Yeah.
So that is anxiety-filled. I got my first score just under a month after post-op. You got yours when? About 6 weeks?
Yeah, just Monday. So, 6 weeks.
Okay. Mine was a little soon, and those always change. And mine came back at 0.04. Now, you read these things, you hear these things, you ideally want it undetectable. Undetectable is 0.000, and then you can find a number way down there. The Blutarsky reference in Animal House, that you want your 0.0 GPA. So when I heard mine 0.04, I'm not going to lie to you, that alarmed me a little bit. I was like, the hell's that 4 doing there?
Yeah, you texted me and you were.
Yeah, I mean, why is there a 4? Why do I have a 4 on my PSA score? This thing's gone. And, it is what it is. Perhaps I did it too early. Maybe it's still settling down. Maybe there are a lot of reasons. I'm going to get another PSA score here in a few weeks.
Sure.
You got your PSA results earlier this week. And you got the magic words.
Yeah, blood test Monday, results Tuesday, and it was verbatim undetectable.
What does that mean? What does that mean? Did they say what that means?
I'm like, so there's no detection of any PSA, and they're like, no, this is undetectable. So I haven't seen the true score.
The actual
card,
score,
right?
yeah.
And so if there's a number somewhere down the line, maybe. But when you hear undetectable, it's like, hey, that's what I was going for.
That's exactly what you want.
I'm going for.
That's exactly what you want. And for a prostate cancer patient, the words undetectable or 0, those are that's heaven. That's heaven for you.
Yeah.
Again, given our Gleason scores, and I've met people, guys, I don't know about you, Jeremy, I've had conversations with 50, 100 guys who have gone through this. Yeah. And I've had conversations with those that had the surgery 10 years ago, and they've been undetectable ever since.
Yeah.
I've had conversations with guys who had surgery a year ago, and all of a sudden it started storming back, and now it's metastasized, and it's in their spine.
Somewhere.
I've had conversations with a little bit of everything. And what I'm getting at is you just don't know.
Just don't know.
And that scares me a little bit.
Yeah. The uncertainty of, one, getting cancer, the surgery, the aftercare, getting your first PSA is, there's so many unknowns, right? It really is. And so
do you right now, you're so happy, and I'm so happy for you, but do you think somewhat because you get that undetectable announcement that do you feel the same again, or deep in the recesses of your brain do you still have that anxiety?
I do, because I think you have to be ever vigilant with cancer. I don't know when it's going to come back.
Yeah.
Don't know if it will come back. Can I be undetectable 10 years from now? I feel like I'm back to normal in all sense of activity and all that.
Yeah.
But I know that, hey, that's always going to be there. I had prostate cancer.
Here's how I view what happened to us here in the last couple of months. And tell me if you have the same feeling, because it's weird. I never thought I'd have cancer. I always thought I was too good for cancer. I thought it was indestructible.
Yeah.
I thought, no, it's not going to happen to me.
me.
What are you guys talking about? What's happened to me is it's given me such a different perspective on life. I'm not going to say it's good that I came down with this, but it's really changed the way I live and the way I look at each day. And I think it's changed it for the good. I manage each day differently. I manage bad situations differently than I did just a month ago.
Yeah, for sure.
I mean,
it is. I think it's just inevitable. And if you don't, I don't know where you were in the place before, but it is changed. You're right. You look at day to day things that used to make me just fly off the handle. Yeah.
You know what I love about Jeremy, guys? You can sort of sense it in his voice. What I love about you and what I envy about you, you really do have that carefree, laid-back personality that I think is required to battle this disease. And I'm not saying that just because I really, the more I think about it, I'm the almost opposite of that. I am like a little puppy dog that continues to bark, and I'm always high maintenance, highfalutin, and I got it. What do I do? What do I do? Where do I go next? And you're more of the, all right, let's see what happens. Let's wait and see, and let's just go ahead and fight this sucker.
Yeah, roll with the punches. Can't change anything.
How do you
right now.
become that way? I want to become more like that.
I don't know how you become that way. I like back in my 20s, I was that. I was like, I got
On
life
edge.
like here, right? And I'm not gonna take any crap from anybody. And I don't know, just over the years, it just has evolved.
So my next, just to show you how different we are when it comes to this, and in the end, we're the same. But man, I've reached out to doctors all over the place asking for advice. I did a genetic test. Those results are coming back soon.
I have mine in, I think, 2 weeks.
Okay.
Yep.
I did a germline a genome test called the Decipher test, which those results will come back any day now. And according to my doctor, the Decipher test will give you more detailed risk on if it'll come back and how it'll come back and if you're averse to certain therapies.
Wow.
So that's the next level. Then I always have in the back of my mind, what about these PSA scans that they have, right? These big PET scans, the ultra magnified scans that can find that cancer if it spreads. When can I do one of those? Have you even thought about doing that?
No.
Well, right now you're undetectable, so it's not going to find anything.
No, and we've had long conversations about what are our next steps, right? And you've done the Decipher.
I want to stay a step ahead.
You're staying a step ahead. Where I'll roll with the punches. I know I can't change anything, even if my doctor said in a year from now, hey, it's in your hip or it's in your bones. Okay, what's the course of action?
Sure.
How do we deal with it? Right?
So you're more read and react with this.
Yeah.
I'm more react and then wait and then get to the and it's funny because I think both it's your personality.
It is your personality.
It's your personality.
Yeah.
It's entirely your personality. And I might be doing this and it's complete waste of time and there's really no reason to go this route. I've heard that these big PET scans, you still have to show some sign of a PSA. You have to have at least a 1 for them to catch it. And if you have anything under a 1, you're wasting everybody's time. Yeah. It's more so for those that have had it metastasized or whatever. I'm going to answer those questions on my own as we move forward because I want to get it all. And I want to zap it and I want to get the hell out of there. I want it out. If I get a sense that there's something in my body, I want it out because it's pissing me off.
Yeah, and that was the test that we talked about at the Mayo Clinic where you're like, I want to know where it is because I'm going to go get it.
Yes.
I'm going to go find that cancer and hunt it down or I just want it out of me, right?
Want to radiate a part of my lung or take out a lobe, whatever.
Yeah.
Whatever. The one thing I've learned in here, maybe I'm speaking too soon, people are so scared of the surgical process. They're so afraid, how will it change my livelihood, just the surgery itself. Again, I can't stress enough. The surgery was the easiest part of this whole thing.
Hands down.
Agree?
Hands down.
We had both very competent doctors, obviously. They knew what they were doing. The robots help. It was the easiest part. The hardest part is managing anxiety and figuring out what to do next, which brings us to our last topic. I'll let you go. You've been great, Jeremy.
Don't go on the internet and go down a rabbit hole.
Get off the internet. The role of the spouse and the family, because my wife has been nothing but spectacular throughout this, and she unfortunately had to watch her mother die a couple years ago via cancer, and it was awful. So perhaps she was ready for this process with me. My wife's been great. She's done everything that you're supposed to do as a great spouse, and I know Brandy, your wife, has done the same.
Yeah, I don't know what I'd do without her. I mean, I can't say enough good about it. It's
and
the
she's
support.
police. She sort of almost played my role with you. She's telling you, whipping you into shape, right?
Yeah, for sure. Yeah.
Like diet.
Yeah, she's like, you come on, look at Vic. Look what Vic's doing. I'm like, okay, we'll get there. We'll get there, right? But yeah, she's her father passed away 9 years ago of cancer, and
What kind of cancer?
He had colon cancer. He had a colon surgery to have a part of his colon removed, and didn't do any follow-up treatments.
Because he didn't want to, or they didn't suggest it?
Didn't want to.
Well, I mean, that's a personal choice.
That's a personal choice, and it killed him. Yeah.
That's a personal choice, because you hear all this, the worst stories I hear. I read this book about diet, and it was like, all right, you go to this diet, you go to the Eastern diet, and all this stuff. And the author that wrote it was a cancer patient himself, and so I'm like, oh, this is awesome, yeah. And then at the end of the book, he died 5 years later. And I'm like, well, wait a minute.
What was it for?
What are we doing here?
Yeah.
I mean, if you're buying a few extra years, I want to talk about buying life. And I hate to sound crude, but I want to make sure we do something that works long term,
right?
Not for the short term.
Not for the short term. Yeah.
So, my next step and your next step may be entirely different, but in the end, we want to see the same thing. We want to see more discussion like this. We want to see the prostate cancer groups out there find more cures, more medicine. And it's crazy. It happened so fast. Just in the 2 months that I've had this disease, I've seen already 2 or 3 revolutionary ideas, prescription medications, things come to the forefront that were never there. And all of a sudden, new things are happening. Yeah. This is fast. People are getting to this fast.
Yep. Yeah. And, I think that one thing, there's all kinds of information out there, right? And as you look for it, you can go find it and look for it. But you have to go do that, where I think that it should be more easily accessible, more in our everyday, talking points. It just seems to be lost in today.
I think this conversation, Jeremy, I want to thank you. If anything, it's therapeutic for us. It's always been, I always admit it's therapeutic for me to talk about it, because when I have it out in the open and outside of my head and it doesn't get stuck in there, it makes me think a little more freely.
Yeah.
I don't know if it does for you. So I'm going to be a little selfish and say we're doing this not only for people watching, but for us. I mean, this is helpful. If you're a new patient or a would-be patient or a newly diagnosed patient, we hope these are effective for you to understand the road you have ahead. Every road is different. I'm not promising you that your surgery is going to be pain-free. It's not a promise. I'm just speaking from experience, his experience and mine. 49 years old, 46 years old. When you hear about prostate cancer and somebody says to me, Vic, do you want to listen to a podcast on prostate cancer? If somebody had asked me that question 4 months ago, I said, what am I, 90?
Yeah,
no.
Ditto, yeah.
But some of you watching this are probably our age and understand how important this is and understand that your fears are legit. But here's what you should be fearful about. It's okay to be afraid. It's okay to be afraid. Be afraid of the cancer. Don't be afraid of all the other crap. The other crap is just crap you can deal with. Be afraid of the cancer. That's key. Would you agree?
Absolutely.
All right, we're going to leave you with this. Just to see what kind of cancer patient you are, prostate cancer patient you are. You have your book bag with you, your backpack. Are you carrying a backup diaper?
Yep, I am.
Let me see it. I want to prove it to me. Let's see. Jeremy Sifkas.
Right here.
This is your work backpack, correct?
Work backpack.
You got your... Let's see. This is what you do when you're a prostate cancer survivor.
Computer, and you have tucked away.
Oh, just a nice little pad.
Nice little pad.
See the difference between the pad and the diaper? This is a man who's secure with himself. This is a man who's not. I carry the diaper. He carries the pad.
Never know when you'll need it.
Jeremy, Godspeed, buddy.
Yep.
Thank you very much. Thanks for walking through this with me.
Really appreciate it. Thanks.
All right.